My name is Usha Sharma and I work as a private GP at the BMI Healthcare. My work mainly involves seeing patients who want a family doctor for all illnesses, from acute illnesses to general health concerns. The type of person that would be best suited to take this pledge is the one who's aware of his or her family history. For example, diabetes, stroke, cancer, high blood pressure. Also the type of person who has a lot of work-related stress or just generally does not have knowledge about how to look after their health. Lastly, a group of people that we as physicians see, and we've diagnosed a condition and want to make their family members aware how to look after their health. The risks involved for those people who are not aware of their health: commonly undiagnosed high blood pressure, which is one of the risk factors for both stroke and heart disease. Also undiagnosed diabetes, which again is a risk factor for heart disease. The group that I am most worried about are the ones who drink alcohol and are not aware about how much they're drinking and what harm it causes to their organs. Therefore, if these people are not made aware, they have these silent risk factors, and by the time they present to us, the damage has already occurred. The possible symptoms people experience if they're not looking after themselves can be quite subtle. My experience, overweight, especially the weight that accumulates around the abdomen, can present with reflux, which is acid coming back into the food pipe. Worse when one is lying down, so disturbing sleep can cause heartburn or a cough. The other common symptom is snoring. A lot of patients who snore tend to be overweight. All these are causing disturbed sleep, tiredness, and then I find that because people are tired, they are tending to eat and probably drink a bit more coffee to keep themselves going. The advice I would give to somebody who needs to consider simple changes in their lifestyle is to consider an appointment with their general practitioner. A check of their blood pressure, their weight, their urine, because that can tell us whether there is any diabetes, will allow the GP to give them some help and advice. Practically, I would suggest to them to invest in a pedometer. It just allows them to count their activity. They do not have to do 10,000 steps a day, but at least one becomes aware of how many steps you're doing. Lastly, diet. What we are buying, what we are eating. And the supermarkets, do sell a lot of convenience foods. So to look at that carefully when they are at the checkout till. I think one of the main reasons why people are not taking notice of the healthier lifestyle is denial, and also believing it could not happen to them. It probably happens to a neighbor, a friend, but not to them. I also think busy lifestyles, time constraints, and how people want to prioritize their free time. For example, exercise can be viewed by some people as a chore rather than being part of their free time and enjoying the exercise. But mainly I think it is denial. After watching this video, I would recommend, if possible, to go and see your GP and just get a baseline information about your health, your height, weight, blood pressure, urine check, to then consider in your daily routine if you can just dedicate 20 to 30 minutes to walking, a perfectly good exercise, and a little bit more time planning the meals before you go shopping.